Hello po and good afternoon. It is a national holiday, one of our favorite holidays po, ang Andres Bonifacio Day. So today we are maalam po natin mabagsik po si Gat Andres Bonifacio. And we are going to talk about a possible mabagsik din po, and that is the Omicron variant. So I'm Dr. York Bondoc. Our program po is called Libreng Konsulta. Yes, please put your questions down below and we will do our best to answer them po. We are also live on YouTube and on Facebook. Please like us and follow us para po ma-aware din po kayo when we are going live. So tara, alamin na po natin what we need to know about the new Omicron variant. Ayan, ang ganda ng tanong. Let me ask the poll. Okay, Reina, say, is it Omicron, 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 or Omicron? Sige, Reina, try your best.
Omicron, Doktora.
Omicron.
But
okay,
I heard
ikaw, Kat, what do
they
you think?
say Omicron.
Ayun ang narinig mo. Okay. Si Miss Kat.
Omicron po para sa akin.
Ay, ang tanong, bakit Micron? Hindi ba dapat Omicron? Di ba Micron, M-I-C-R-O-N? Like 10 microns? How about microscope? O, diba?
Oh, yeah. Opo.
Ikaw rin. Nataranta ka sa microscope, ano? Well, guys, definitely there's a lot of disagreement and kwentuhan and tanungan about the proper pronunciation po nitong bagong COVID variant na to. And siguro linawin lang muna natin how to pronounce before we go into the history. Ano po? So pinag-aralan ko rin ho how to pronounce this. And most newscasters po, actually nag-away pa ho kasi yung mga ancient, yung mga Greek scholars, they are putting it po as Omicron. But napapansin ko po, since nanood ako ng CNN, NBC, at lahat na, maraming nagsasabi ng Omicron or Omicron. Okay? So, ako, I would say Omicron. Pero hindi naman po mali yung Omicron, ano? Pero mas ginagamit po yung Omicron and Omicron. O, yan na, malinaw na. Reina, repeat after me, Omicron.
Omicron, Doktora.
Ayan. Okay, hindi naman po talaga mali ang Omicron. Some people actually use it. But micron nga tsaka microscope, ano? Pero nakararami po yung Omicron. Okay, how did we get this name? O sige, since we got to the pronunciation, how did we get the name? Well, dati po, no, it was named after the place. Like the alpha po, the beta, the alpha, the beta, and the gamma. Yun na po ang pumalit from the UK, the South African, and the Brazilian. So, pinalitan na po because it is discriminatory towards the place. So, yung sumikat po talaga is the Delta. But, if you notice, the Omicron is not actually the next Greek letter after the Delta. Merong new, NU, at saka CXI. Yung NU po, hindi na po nila ginamit kasi parang new variant, parang confusing, diba? NU. So, wag na. The letter XI naman, it's ang dami pong Chinese named XI or C. So we do not want to discriminate nga about that certain place. So they chose the next letter, which is Omicron. Okay? Or Omicron. Omicron. Okay? So yun po, that's the story on how it got the name. Later on, let's go more into the history. Ayan, pumunta na nga tayo sa history, ano.
How was it discovered, Doktora?
Sige. Ang kwento po dito, this variant po was discovered po in two places po. No? Actually, from Botswana po ito. Where is Botswana? It is a country po in Africa. Kaya lang, why was it discovered in South Africa? Kasi po magkakatabi lang po yun. And in Africa, South Africa has the most extensive laboratory doon. Meron silang magandang genetic laboratories in South Africa. So they were able to gene sequence this po. And that's how it was found out to be a new variant different from the Delta. Okay? So, nalaman po nila na may bagong variant kasi dumadami po, no? There was a certain place po in South Africa na dumadami po biglaan yung mga kaso. So, sinequence po ng South Africans and they found out that it is a new, it was increasing in the province of Gauteng, South Africa. So, inimbestiga po nila yon and they sequenced it and then parang tumataas bigla yung low cases. So they sequenced it and they said, aha, hindi ito Delta. This is a new variant. And then South Africa, to their credit naman po, thanks God, open sila sa mundo. Sinabi talaga nila. And ayun, nagumpisahan na yung mga travel bans. And actually, ito lang ang masama, Reina and guys listening. Once the gene sequence finds it, kumbaga, kumakalat na po siya even before we were able to gene sequence. So basically, late na po talaga si gene sequencing kung yun naaasahan natin. And with our, our modern transportation system talaga, it will really go all over the world. Kasi, mabilis po talaga ang ating pong jet travel and yung the number of people in the plane. Meron ngang plane na 61 persons were already positive. Doon pa lamang sa loob ng plane. So, nahawaan na po yan. Okay? Nahawaan na po talaga. So, that's how it was discovered. They traced it to Botswana, but the South Africans were the ones who were able to gene sequence it because there was a flare-up in one of their provinces. So, what are the countries? All over Europe na rin po. Sa US, hindi daw magagulat si Dr. Fauci. 2 persons in Hong Kong got sick. And basically, dumadami yung may Omicron virus or Omicron variant of COVID. Well, this is very interesting, Oo, sige, Reins, ask your question. Ayan, thank you so much for this question, Reina. Right now, it looks like it's spreading quickly. Kasi in one plane, naging 61 positive na kaagad. So may possibility po talaga na mas nakakahawa po ito. And the reason po na naging mas nakakahawa po siya, it has many mutations on the spike proteins. Di ba, I explain na bakit nagmi-mutate. Nagmi-mutate po as the virus moves from person to person, kailangan dumami po siya, kailangan niya manganak. Sa pag-aanak po niya, hindi po perfect lahat ng gene sequencing ng some of the genetic code has a mistake. Pag naging favorable po, like lumakas po, the mistake gave it superpowers, kumbaga. Yun po yung mangingibabaw. Ngayon po, si Omicron has many mutations on the spike protein. Ito po yung nasa labas, no? These are the spikes at the outside po ng virus. It has many mutations po that allow it to enter the cell quickly. So, yun po yung element ng pagiging nakakahawa. Okay? May kasabihan nga po, if the Delta was 7 times more nakakahawa than the original Wuhan, I read this article na 500 times daw mas nakakahawa ang atin pong Omicron variant of the COVID virus. So it is because of the mutations in the spike protein, balita po talaga siyang mas nakakahawa. Actually, sa Hong Kong, nag-usap lang daw sila sa corridor na hawak agad yung isa.
Okay, next question. Doktora, mas mabagsik po ba ito?
Yan ang magandang tanong, Reina. Because yes, what will be the effect if you get sick po with the Omicron? Ang balita po talaga around the world and pinag-aaralan po ito ng mga scientists is that it seems to be mild Kasi wala namang increased death rate But again, it's so early to tell. Too early to tell. So whether, yes, I would think mas nakakahawa siya. Whether mas mabagsik siya remains to be seen.
Okay, Doktora, travel bans, effective po ba?
Ikaw, Reina, what's your opinion?
Well, with all the things that you have said earlier, parang
nauna na. It could even be here.
Yeah, before, alam mo, mas mabilis siya sa chismis, Doktora. Yun lang ang masasabi
ko. There's only one thing faster than chismis and that's a variant.
Yes. Yun lang po ang masasabi ko. For all we know, nandito na pala. Diba? For all we know.
True. Ang ano ko dun sa travel ban, magagalit kasi yung mga tao talaga pag walang travel ban. And I would say, hindi naman siya travel ban eh. Tayo kasi sa Pilipinas, we cannot really have a total travel ban kasi we have OFWs returning. So we cannot just close the Philippines unlike Australia and New Zealand na talagang pati namatayan ka, you cannot go back to Australia and New Zealand for a really long time. Sa atin, because of the number of OFWs arriving in the Philippines, we cannot really totally ban eh. At saka yung ano kasi, for example, i-travel ban mo sa South Africa at saka yung mga Botswana, gano'n, ano. Kaya lang, the world, grabe na talaga yung traveling eh. Kumbaga, pwede kayong magkita sa loob ng airport. Diba? I mean, when you have a stopover, alam ni Kat ito as a tourism graduate, when you have a stopover, maghahalubilo yung mga tao doon from different airlines. And then they board the plane to Manila. Hindi naman sila actually yung nanggaling sa South Africa, but pag nagkita kayo doon sa ano, yung sa airport, sa lounge, kumain kayo, etc. May nakahalubilo ka na dong other persons. So it is effective rin. I would say it is not 100% effective, pero it could delay the entrance. Of course, tama ka rin naman, we do not know if the Omicron is already coming out here. Posibleng hindi lang na gene sequence because we do not 100% gene sequence all our positives. Pero I guess it can't hurt naman to have a travel ban and to be more cautious. Yun lang. Pero kung aasahan po natin si travel ban na yun po yung solusyon ng ating problema, that's not the answer. The answer really is to keep on vaccinating, is to wear mask, social distancing, mag-ingat pa rin, be cautious pa rin, and the second one po is of course, before it gets here, sana keep on vaccinating po tayo.
Okay. Ayan na. Speaking of vaccination.
Ayan na nga.
Is vaccination still protective, Doktora?
Marami po talagang nagnervyos kasi sa dami po I think there were 30 mutations. Meron pang mutation na mas nakakahawa, able to enter faster. Meron pang mutation na able to evade viral antibody surveillance nung vaccination. Meron pang able to evade daw T cells. So napakarami talagang mutation dito that just makes it really scary. Pero again, I would still vaccinate kasi hindi pa naman natin alam talaga. Sa akin, I don't think that the protection of the vaccine is zero. At the worst case, baka bumaba. But still, any form of protection is still better than zero protection. So, meron nagsasabi sa akin, oh my God, wag na tayo magpabakuna kasi hindi daw protective. I don't think that's the proper Halimbawa, the protection is 90%, then it becomes 70. Ang tanong ko sa'yo, ayaw mo na 70. Mas preferred mo si zero. So, mali po yun na don't vaccinate. Ang importante po is vaccinate and take care. And then, hintayin po natin yung mga pronouncements po ng mga scientists. Pinag-aaralan na po ito ng maigi. And then, move on po tayo from there. But ako po, I really don't think that the vaccination protection is immediately gonna go to zero. Wala pong ganun, And there are still a lot of factors to consider. So, sa akin, what I would do with regards to this, okay na po si travel ban. It may delay the entrance of the virus. It is not 100% the solution. Pero better than wala, And then secondly, awareness po that we need to wear mask and social distancing kahit mababa yung cases. And of course, keep on vaccinating po. Keep on vaccinating. Para ko, wala hong malipatan talaga yung virus kasi even 70% protection is still better than zero. So yun po yun. And again, will this become a huge problem? We do not know. Remember the Philippine variant? Nakakatakot din yun. And there were so many other variants. Meron pang Delta Plus. But there are a lot of factors that would determine whether the variant will really become the dominant variant or iikot sa mundo. So there's still a lot of things to be found out. Okay?
Okay, next po.
Ayan na. I think we have a few questions. So,
Yes.
sagutin po natin yung mga tanong ng mga nakikinig.
Okay, from Miss Desiree Espinar. Doktora, good afternoon. Kahit fully vaccinated po ba, possible na mag-severe pag tinamaan ng Omicron virus?
Ma'am, thanks for that, Ma'am Desiree. We really don't know, pero ang naririnig ko po, di ba, tinanong ko sa iyo, mas mabagsik ba? It seems to be not that mabagsik. Okay? Kasi parang yung mga cases po na nasa South Africa, parang mild daw eh. Marami pero mild. So again, it remains to be seen. So kung kayo po ay nakapila sa bakuna and today is vaccination days, I would still go through with my vaccination.
From Ms. Zari Cruz Larin, magandang araw po. Ang bagong variant po na Omicron, mas madali po bang mahawaan nito ang mga nagka-COVID na?
Actually, Ma'am Zari, that's a very good question. Kasi ang balita po, no, ang taong na COVID plus may vaccination, ibang klase pong mga antibodies talaga ang nag-generate nung infection, ibang klaseng antibodies ang nag-generate po ng vaccination. And put together, they seem to be parang maganda na ho yung protection nila. So again, we don't know that. But again, ang advice ko, kahit na COVID ka na, still get yourself vaccinated. Kasi iba po yung antibodies ng na-COVID, iba po yung antibodies ng na-vaccinate, and put together, they seem to be a good protection.
Okay. From Ms. Jesnil Lubay. Doc, ask ko lang po, November 18 ng first dose, tapos second dose January 11 na. Okay lang po ba yon? Medyo malayo ang agwat ng first sa second dose. Almost 1 month mahigit. Salamat po sa sagot.
Almost 1 month mahigit. Ano pong vaccine ito? Kasi ang Astra is 3 months at saka konti na lang po yung Astra. Ang Sinovac is 1 month. And I think Pfizer is 3 weeks. Ma'am, please elaborate more, okay? Hindi ko po masagot. Please elaborate more. Anong bakuna po ito?
Okay. From Ms. Shay Villanueva Bayot. Hello po, Doktora. Good afternoon po. Ask ko lang po sana kung safe po ba inumin ang Zcast or Zycast kapag nagpapabreastfeed. Meron po kasi akong bronchial asthma. Di po ako makainom agad ng gamot kasi nagpapabreastfeed ako. Di ko po kasi alam kung safe siya inumin. And safe po ba magpa-vaccine kapag may asthma and allergy? Salamat po.
Ang alam ko po, Zycast is Montelukast, if I'm not mistaken. Ano po? Wala naman po akong alam personally na against po sa breastfeeding. Ano po? I personally haven't heard anything against Montelukast. These are the anti-allergy po ito and anti-asthma for breastfeeding. So my best advice po sa inyo, ibalikan niyo po yung pediatrician. But I personally naman haven't heard anything bad. If you would like to switch to inhalers, better po yun if you like. Though some people react better to Montelukast. Pwede naman pong magpareseta ng inhalers po sa inyong doktor kung gusto niyo pong wag kayong uminom. Kasi yung inhalers po, hanggang baga lang yun. It does not go into the blood. Okay? So, if you'd like to take something na hindi po papasok sa dugo, you may consider switching to Ventolin, Salbutamol, and yung long-acting yung Seretide. Okay? So, pag-isipan po niyo yan. Can asthmatics? Yes, asthmatics po should be vaccinated. Kasi po, may sakit po sila sa baga, no? They are very, reactive ang kanilang baga. So, kung ma-COVID po yan, baka sumabay po yung, yung asthma nila. So, yes, please get yourself vaccinated. Pwede po bang magpabakuna ang breastfeeding moms? Yes, ma'am. Pwede po.
Okay. From Ms. Darlene Lindo. Hello, Doktora. Tanong ko lang po, pwede po bang magpa-vaccine? 2 weeks pa lang siya na opera sa paa. Umiinom po siya ng gamot ngayon. Thanks po.
Actually, the answer is yes. Kung tinawag na po kayo for the vaccine, you can actually be vaccinated na po. My best advice, kumuha po kayo ng clearance dun sa nag-opera. Okay? And I don't know po kung anong gamot. Baka antibiotic ang iniinom nyo. My feeling po is yes, this person can be vaccinated. But please get a clearance po from your surgeon. Okay?
Okay. From Ms. Kiambao, Mary Ann. Doktora, 3 months na po akong nakapanganak. CS po ako at breastfeeding. Pwede na po ba akong magpa-inject ng anti-COVID? Please po, sana masagot po.
Yes, pwede na po, ma'am. Yes, you can get injected po with anti-COVID. If you feel well naman po after your CS, you're okay, nagbe-breastfeed na po kayo, go na po.
From Miss John Riel Glorioso. Hello, Doktora. Severe effect pa din ba ang Omicron sa mga fully
Pwede rin
vaccinated?
OMICRON, okay guys?
Yes,
Pero mas common talaga si
Doktora.
Omicron. Oo.
Yeah. Omicron sa mga fully vaccinated ka na?
Ma'am, ako I'm vaccinated. I had my booster yesterday. Ang pakiwari po ng mga scientists is vaccination will still protect you. Whether it will be severe, ang feeling ko po, ako personally, I still feel that there is a protection talaga. Imposible pong zero protection po yan. So, I cannot answer that kasi pinag-aaralan pa po yan ng mga scientifico. But if you were gonna be vaccinated today, magpabakuna ka pa rin. Because, meron pa ring Delta, no, na umiikot. So, you still could get protection. And then, number 2 po, no, what can I say? Kung severe, it's still being studied. I would get vaccinated and I wouldn't be too worried. Basta talagang keep safe and protect yourself. Pareho pa rin ho yung solusyon. And, ito pala, what I forgot. Pinag-aaralan din po ng mga Pfizer and Moderna. Kasi yung mga mRNA vaccines, madali pong baguhin. So, they're immediately studying it if they need to reconfigure the vaccine sa ito.
From Mr. John Riel Glorioso. Hello, Doktora. Severe effect pa din. I think nabasa na po ito, Ma'am Kat.
Oo, yan yung kanina.
From Ms. Naylor Pem Cansilan Tadle. Hello po, Doc. Diabetic po ako. Nagka-cramps ang legs ko. Pwede po ba akong magpa-vaccine?
Yes, ma'am, you can get vaccinated. All diabetics, even with leg cramps po, talagang kailangan. Actually, hindi lang po pwede, dapat. Kasi imagine, ma'am, naka-cramps na yung legs nyo, tapos sabayan pa ho natin ng nahirapan pong huminga. That's not good pag na-COVID. So yes, please vaccinate. 29, 30, and 1. Talagang national vaccination days po. Ito, sumugod na po kayo sa vaccine site.
From Miss Editha Guico. Okay po ba kung may COVID vaccine ka na, magpalagay ka pa ba ng anti-pneumonia?
Pwede po. That's okay.
From Miss Clarice Tobias, good day po. Okay po ba fully vax po at the same time po may anti-flu at anti-pneumonia? Thanks. God bless po.
Good yan, good yan. Okay po yan.
From Mr. Fred Manamtam, Doktora, completed ko po ang second dose Sputnik V vaccine ko last May 24. Pagdating ng first week ng September, nilagnat ako at naging positive ang RT-PCR test ko. Mild lang po ang mga simptomas po. Ask ko lang po if advisable na po ba akong magpa-inject ng booster shot. By the way, I'm 62 years old na po ako. Wala naman pong comorbidities. Sana mabigyang pansin niyo po ang tanong ko. Salamat at naway pagpalain po kayo.
Sir Fred, thank you for this question and congratulations for being vaccinated po with Sputnik. Or ang tawag po na Sputnik, another name is Gamaleya. Okay? So right now po talaga, I would say na it's good that you got vaccinated kasi po you're a senior and I'm really happy na kahit na positive po kayo, mild lang po yung nangyari sa inyo. That's really the promise of the vaccine. Should you get a booster shot? If you want to, you can, no? Kasi po the government has already allowed booster shots for seniors po, A1 frontliners, A2 seniors, and A3 comorbids po na mga na-transplant, ganun po, na leukemia, na nakikimotherapy, ganun po, no? So yes, you are already in the category. If you want to have a booster, you can. If you want to wait, hindi rin po masama. Okay? It's not bad to wait. Kasi some people are waiting for more data. But if you want to, my answer would be yes.
From Ms. Weng Patdu, hello po, Doktora. Pwede po ba yung AstraZeneca sa 18 years old at meron po siyang asthma? Salamat po sa pagsagot.
Ma'am, yes, actually pwede po. No, sa kids po, what was advised is Moderna. Pwede po ang AstraZeneca for 18 years old and if they have asthma, that is also okay. Wag po kayong mag-alala. Okay po yon.
From Ms.
Wait lang balikan po natin yan If you are, ito lang if studies and personal knowledge and conversations with other doctors, ang pinakamababa pong side effects is Sinovac. Okay? Honestly, ako po na Pfizer, talagang Diyos ko, ang bigat ng kamay ko. I never felt that way with Sinovac. And I already took paracetamol, ha? So, if you are really so scared about side effects, and sino ba namang hindi, okay, it is a valid choice po to take Sinovac. And Sinovac is effective and safe.
From Miss or Mr. DC Sumang, Doc, ask ko lang po, kung pwedeng magpa-vaccine, may asthma at high blood. Kasi po, everyday po nakasumpong ang asthma ko. Willing naman po ako magpa-vaccine kaso baka di ko kayanin. May maintenance naman po ako sa high blood, amlodipine at sa asthma Symbicort. 160 at nagba-vitamin din po ako, Revitaplex. Salamat po sa tugon.
Ma'am, high blood, yes, you can get vaccinated, and asthma, you can and should actually get vaccinated. Ang problema ko sa iyo, ito, okay? Kung hinihingal po kayo sa araw-araw, and sometimes even asthmatics, they are coughing, okay? Ang advice ko po sa inyo, asikasuhin nyo muna, you may need to take oral steroids or something po muna to control your asthma. You will ask me why. Kasi isipin mo to hinihingal ka, you're going like this, humihuni ka all the way to the vaccination center. Talagang pag na-check up po, check up po yung mga tao dun eh. Pag na-check up po kayo humuhuni, nahirapan huminga, possibly even umuubo, naku talagang papauwiin po kayo and you might even be isolated for possible COVID. Kasi syempre, hinihingal ka, no? You're having a hard time breathing, you're coughing. In this day and age po talaga, matatakot po yung mga tao and you will not be vaccinated. So ano po ang dapat nilang gawin? What you should do po is go to your pool mo. Kasi merong nagbibigay sa'yo ng Symbicort. All of these are good drugs. But kung kulang pa po yun and you're really taking it really every day, you might need po to have a short course of steroids or ano po, i-up po yung gamot nyo. Okay? So my advice to you, yes, you can get vaccinated. Yes, you should get vaccinated even though may high blood and asthma. Ang problem lang po, baka hindi po kayo bakunahin dahil hinihingal po kayo sa araw-araw. So, solusyon, magpa-check up po, talk with your pool mo and see po kung ano pong magagawa nyo to control your asthma, and after that, bakunan na po.
Okay. Next po. From Miss Jocelyn Dungkalarin. Good day po, Ma'am Doktora. Pwede po bang bakunahan ng bakuna ng anti-tetano? 3 days pa lang po ang nakaraan.
Ma'am Jocelyn, I had that question from my husband also. I would like to assure everyone what I am telling you is not specific to you, general advices lang po ito. It is still very good po to consult your personal physician. Okay? Ito pang malahatang knowledge lang. But ito po, no, ganito, Ma'am Jocelyn. If you have been vaccinated with rabies or anti-tetano, let's say a dog bit you, and then 3 days after you were vaccinated, nag-text po si vaccine, araw nyo na ho, no? My best advice to these people is, wait muna. Okay? Kung 10 days, ganon, 1 week to 10 days, wala naman pong masama. Kumaga, palipasin mo muna yung rabies and tetanus issues mo. Okay? Like, I don't know if you got vaccinated with rabies, but usually together yan, okay? But basically, wait a week. Pwede. Wait 10 days. Para tapos na tapos po yung issue nyo ng unang bakuna and then pabakuna ng COVID. Okay? Kaya lang, eto naman, Reyna, halimbawa, baliktarin natin. Okay? Nabakunahan ka ng COVID. Going home from the vaccine center, a dog bit you. Okay? Then, umalis na yung dog. Di mo dog. Okay? Umalis. Huwag ka nang umuwi ng bahay, pumunta ka na sa ER at magpabakuna ka ng rabies and tetanus kahit yun yung araw ng pagbabakuna mo ng COVID. So, naintindihan mo yon? Why? Kasi po, yung rabies and tetanus, wala pong gamot doon. So, you need to be injected. Pero, if you, nakuha mo yon, kasi importanteng mabakunahan ka ng rabies and tetanus kahit na araw yun ang bakuna mo ng COVID. Like, kung nauna po si COVID, then pauwi, kinagat ka, then go straight to the ER and get yourself vaccinated. Pero halimbawa, nabakuna ka ng tetanus or rabies, wait mo lang muna po ng mga 7 days before the COVID. Why? Kasi you can wear a mask muna eh. Wala ka pa namang COVID, di bakuna lang ho yun ng COVID. So you can wear a mask. So dapat, naintindihan mo ba yun, Reyna? Did you get my point? Did you guys understand my
Yes.
answer?
Opo, opo.
Oo, kasi wala pong gamot sa rabies and tetanus. So, kung kinagat kayo on the day of the vaccine, let's say, pauwi ka, kinagat ka, go straight to the ER kasi walang gamot nun. So, you need to be vaccinated. Pero, halimbawa, nagpa-tetanus ka and then you receive a text, please go to the vaccine. You can wait for 7 days. You can wait for 10 days. Okay? And then, that's the time you get the COVID vaccine. Kasi wala namang emergency si COVID, okay? Pwede ka naman mag-mask doon sa bahay mo. Pero, rabies and tetanus is an emergency. Yun.
From Miss Julieta Mapanaw, Ibarra. Good evening po. Pwede po ba magpa-vaccine ang nag-COVID after 1 month? Salamat po.
Yes, ma'am. Actually, people always ask me that, Doktora, na positive po ako. And how soon after being positive can I be vaccinated for COVID? Ma'am, as soon as you finish the 14 days isolation and you are feeling totally okay, like wala nang ubo, wala nang lagnat, magandang pakiramdam, pwede na pong magpabakuna ng COVID. If you are not feeling well, you can wait a few days naman po hanggang okay naman po yung pakiramdam nyo. But basically, kailangan po, you have to finish 14 days at hindi na po kayo inuubo and you feel well, bakuna na po. Okay?
Okay, from Miss Annabel Campos. Hello po, Dr. Ana. Ano kayang magandang inumin para maalis ang sipon? 21 years old po. Thank you po.
Ma'am Annabelle, just make sure sipon yan baka COVID yan. And then, panahon po ngayon talaga, you really need to make sure, halimbawa, sinisipon ka, wala ka ng pang-amoy at panlasa, moving on na po tayo, need to be isolated. In general, I do not, kung sipon na sipon lang ha, in general po, I am very conservative about giving medications po to a simple sipon because mostly it is viral and it will go away on its own. So ako po, I do not like to give medications sa simpleng sipon. Ngayon, kung nagtatagal, then requires further investigation. Allergic rhinitis ba yan? Bronchitis ba yan? And you may need to take decongestants or anti-allergies depending on what's going on. Pero kung simpleng sipon lang po, hindi ako mahilig magbigay po ng kahit anong gamot. Over-the-counter juices, maybe kung inuubo, you might try some over-the-counter gamots. Pero ako po, I am not fond of giving gamots po to simple sipons. Okay? Sa akin lang po yun.
From Doc Nina, hi, Dr. Ana. I guess,
Hi,
Dr.
Doc Nina.
Apo, do you still want to continue? Because we have a lot more questions or...
Siguro last two para
last
mapagbigyan po.
question. Okay
Yan.
po. From Miss Grace Chan, Franson. Is booster giving after 6 months?
Ma'am Grace, the Philippine government has approved the booster doses after 6 months after the second dose for the following individuals po. Number 1, frontliners. Number 2 po, seniors. And number 3 po, yung mga comorbids po, yung mga, limited pa lang yung comorbids ha, cancer, transplant, chemotherapy po, and leukemics. So yun po, we will wait for the government to expand pa more po. Baka maging all comorbids. Let me check nga yung comorbid booster. Wait, baka nag-expand yung gobyerno kanina. Pero right now, ayan. So ano talaga, ilang po, yun lang po, persons with comorbidities. So, usually, the comorbidities is limited to cancer, chemotherapy, and transplant. Pero merong ibang mga LGU, medyo wina-widen na rin po, including diabetics and dialysis. So, yun po yun, 6 months. Other countries are starting to make it different. So, tingnan po natin. Okay, last na po.
For our last question from Miss Janine Kiambao Yabut. Good afternoon po, Doktora. Tanong ko lang po kung okay lang po kaya na hindi na magpa-second dose ng Sinovac ang kapatid ko dahil po nagme-medication siya dahil sa Bell's palsy ng prednisone. Sabi po ng family doctor namin nung time na kasalukuyan siyang umiinom ng prednisone, ay baka hindi daw po tumalab ang vaccine. First dose po ng kapatid ko ay October 5, 2021 pa po. Na-diagnose po siya ng Bell's palsy November 4. November 5 dapat ang schedule ng second dose niya. Maraming salamat po.
Ma'am, there's a lot of layers to this question. Sinovac is not known. Bell's palsy is a known, is a known side effect po ng medication, but usually AstraZeneca po yun at saka Gamaleya. I really haven't heard too much about Sinovac and Bell's palsy. Ang best advice ko po sa inyo, ganito, no? You should consult po not a family doctor but a neurologist, yung nagbigay po ng prednisone. Have your sister check po ng mabuti. We need to determine whether the Bell's palsy came from the Sinovac or not, and whether or not she should receive Sinovac as the second dose. Ang issue ko lang po is, my issue po is not hindi po tatalab because of the prednisone. My issue is, did the Sinovac come from the Bell's palsy? Did the Bell's palsy come from the Sinovac? Ang pakiwari ko hindi eh. Kasi talagang Bell's palsy and other neurologic disorders is associated po with Astra and Gamaleya. And even Pfizer and Moderna. Pero I haven't heard sa Sinovac. So my best advice, see your neurologist, the person who gave the prednisone, and have a consultation po sa kanila. Whether, sa akin hindi issue yung naka-prednisone eh. Sa akin issue kung galing po dun sa Sinovac yung Bell's palsy. Okay? So pag-usapan niyo po yan na mabuti and then make a joint decision po. Okay? So that's it, guys.
Yes po.
Thank you so much for watching. Again, Omicron or Omicron. Salamat po.